Welcome back to America's Web Radio and the program Healthcare Insight. We're glad you're continuing to follow us. Now we want to get back to building on the ideas of how do we create a private free market system? How do you as a consumer understand what's possible out there, what you should be looking for, what you should be anticipating in terms of post-Obamacare? What are the things that could happen in your state, even with Obamacare, and states asking for state innovation waivers? We're going to talk about all that. This is not pie in the sky. This is not academic solutions. These are real tangible issues and potential solutions that are being discussed at the state level and at the federal level. Healthcare is going to be a major issue in the upcoming presidential election. And it may be after the presidential election that we'll actually get some federal legislation that will give some relief to consumers out there. They're looking for more affordable health insurance products, to give some relief to patients who are out there trying to access good quality health care from the providers that they trust. The doctors that has the most important relationship between any patient. It's that patient-provider relationship that needs to be strengthened. But we won't get to any of that until we actually step back for a moment and say, what are the basic principles that we want to develop a new system around? What are some of the ideas that are so important that we need to keep those in mind as we propose and develop a new system of healthcare? Well, number one of the basic principles would be consumer empowerment. Consumers need to be knowledgeable about what's affordable in terms of health insurance, and they want health insurance that covers pre-existing conditions. So consumer empowerment is the number one basic principle. How do we do that? How do we create a consumer empowerment environment where today it's been an insurance company empowerment? Consumers had very little influence on what's available, knowledge about transparency of costs, how or why they might be able to access insurance, why they're turned down for insurance. Number two, voluntary participation. Individuals and employers should not be forced or mandated to secure health insurance. Insurers' participation should also be voluntary. We should set up a system that if the insurers don't want to participate, that's fine, but we want to set up encouragements that insurers will actually want to participate in this consumer empowerment environment. We should create market advantages for these new products that insurance companies would want to be participating. And for companies that don't want to participate, those advantages should not be available to those insurers that don't want to participate. Item number three in basic principles, personal responsibility. Personal responsibility means consumers or patients taking ownership for good and bad health care and health decisions. You know, Obamacare put everybody into a single risk pool, so it didn't matter what your own personal or even company approach was to helping people with good decision-making around health and health care. Well, the alternative to that in developing a system is to focus on personal responsibility and saying everybody also has a right to be in their own risk pool. If I'm doing good things, if I'm making good decisions, I should be in a risk pool with others that are making good decisions so that our costs are lower, that we're doing things that help keep us healthy, we're doing exercises, we're eating good foods, we're not taking risky situations that endanger our safety, our driving habits are good, all the things that would create good health, along with our own personal genes. Some have good genes, some have bad genes. But we should be able to deal separately and more effectively with people who have bad genes, don't take care of themselves, or had the maladies of life just happen upon them. It wasn't their choice. They could have been doing the greatest decision-making in the world, but they have cancer. They have a heart attack. They have some disease that's debilitating. We should be able to take care of those people. In fact, any system of personal responsibility that lowers costs for many people doing good decisions also has to be a system that takes care of the sickest among us. So we're not talking about a system which actually used to be part of the pre-Obamacare health insurance environment that kind of took the bad decisions, the bad luck, people who had diseases either at birth, an accident occurred to them, or the maladies of life happened upon them, and kind of shunned them aside and put them into what I'll call high-risk pools, bad coverage, high cost. We kind of wanted those people to just go away, just forget about them and say we have an outlet for them, but it really wasn't. So personal responsibility includes a lot of different items that we need to be sure are taken care of in any new system. Fourth item is choice. Choice means personal decision options for insurance coverage, for medical care, for treatment plans, providers, compliance, participation, lifestyle options, wellness activities, disease condition support programs, service conveniences, and educational sources. There are choices all over the place that we need to make as consumers. We make choices every day, and every other purchase we make, we decide the level of sophistication, expense, quality, brand name, all those things. We make choices every other day in every other place. We need to bring those choices to healthcare. And it's not just choice about insurance coverage and medical care, it's choices about all sorts of things that we do even after we purchase insurance, after we've seen our doctor. Are we going to be compliant with care? Are we going to change our lifestyles? Do we have certain wellness activities that we participate in to help stabilize our condition? You know, a stable diabetic is a lot less cost than somebody who's not and has to be rehospitalized, may go blind, lose a foot, have all sorts of complications. So choice is a very broad term that has to be built into the system. We need to be able to give people choice. It has to be market-based. It has to have a legal and regulatory system that allows an open, competitive, free market health insurance system. I mean, that's the key. We've been talking about a private, free market healthcare system. It has to be market-based. But market-based doesn't mean no government. It means limited government. It means appropriate government. It means focused government. So there is a regulatory environment that we will describe and lay out for you to help create this private healthcare system that actually works for consumers, works for patients. The sixth basic principle is increased competition. Robust competition in an open, free market is the best solution to lower prices, better services, higher quality, greater convenience, and more choices. Unfortunately, in today's world, we actually have very limited competition. There are fewer and fewer insurance companies to even buy products from. There are fewer and fewer products that we can even buy if we go to any one of those. In terms of hospitals and doctors, there are fewer and fewer choices. Hospitals are buying up other hospitals. They're buying up physician groups. Physician groups are coalescing into larger physician groups, all on the basis of needing more power to negotiate with the other parties, the insurance companies that are setting the rates. Hospitals need to get bigger to compete against big insurance companies. Physician groups need to get bigger in order to compete against bigger hospitals. They need to be able to market themselves as admitting physicians to hospitals so they have access to the services to be able to provide the surgeries and the care that patients need. So we need increased competition. Number 7, ownership. Ownership means consumer possession of the financial assets, the choices of how we spend personal care funds, and the right to information regarding one's own personal health and healthcare records. We need to take ownership of our own health. We need to recognize that health is our own human capital. What makes us valuable to anybody else, our family, our friends, our community, our job? It's obviously our education, our knowledge, our creativity, our relationships, our networking. But at the bottom line of all that, it's our health. If we don't take ownership of our health and recognize that without good health, all that other stuff goes away. It doesn't matter that you're educated in some fancy program, that you've got some credentials after your name, some letters after your name, professional designations, Ivy League colleges, whatever you want to put there. If you don't have your health, none of the rest of that really makes a lot of difference. The eighth basic principle, portability. Portability allows individuals to continue coverage regardless of their employment status and/or job changes. Policies do not rely on employer-based insurance should be encouraged and expanded. The individual marketplace, which is a relatively small part today of health insurance, needs to be expanded. Ninth item is transparency. Market-based systems can only be effective with an abundance of information easily available and understood by consumers. Transparency of information for cost, quality, and treatment options. You cannot have a free market unless there's information out there for people to choose and make the good decisions. Now, transparency is a term that many would argue against because it's an industry term and many people really don't fully understand or appreciate that transparency can be argued against by many of the people who don't want to disclose prices because they'll say those prices are proprietary. I don't need to disclose my cost relationships between the hospital and the insurance company. They may be different from somebody else, and I don't want them to know what that cost is. So I prefer the term, the right to know. If there's data and information out there that the consumer needs to make good choices, they have a right to know that data. They have a right to know those costs. It's hard to argue against the right to know where some would argue against transparency. So I would replace right to know almost any place I see the word transparency. Number 10 as the item of basic principle. The use of technology. Healthcare, and health insurance all need expanded use of technology to lower the costs, improve efficiency and effectiveness of coverage, and appropriately identify and distribute information. Technology is clearly the wave of our future across society, and it clearly is the wave in health and healthcare. Unfortunately, the way technology has affected health and healthcare today is that more technology means more cost. In every other business, technology lowers cost. But somehow in health and healthcare, technology increases the cost. So here we are once again at the end of this segment. Let's take a break from Healthcare Insight, and we'll be right back with America's Web Radio and our next section in just a few moments after these words from sponsors.